You can survive open-heart surgery without ever waking up. But what if your eyes opened in the middle of it? Imagine this. 1 second you're unconscious. The next, you hear voices. Metal instruments clinking. Machines beeping. Bright lights burning through your vision. And here's the strange part. Nobody knows you're awake. For nearly 2 centuries, anesthesia has made modern surgery possible. Before it existed, patients relied on alcohol, opium, or sheer luck. Today, powerful drugs can shut down awareness completely. At least, that's the plan. Because in extremely rare cases, something called anesthesia awareness can occur. Your mind wakes up. Your body doesn't. At first, you'd think the operation was already over. The room sounds distant. Your thoughts feel slow. Then you notice a tube in your mouth. You try to move. Nothing. You try again. Still nothing. Panic begins spreading through your chest. What happens next changes everything. As your vision sharpens, you realize surgeons are standing over you. The procedure hasn't ended. It hasn't even started. You want to scream. Warn someone. Blink. Lift a finger. But your muscles are chemically paralyzed. You're fully conscious inside a body that refuses to respond. And that's when a terrifying question enters your mind. If you're awake, how much of this are you about to feel? The answer is worse than most people imagine. And that's not even the craziest part. The first incision comes without warning. A sharp line of pain explodes through your chest. This isn't discomfort. This isn't pressure. It's pain on a level your brain was never meant to process while conscious. But here's the strange part. The doctors may not notice. Normally, intense pain causes a racing heartbeat and obvious physical reactions. But during major heart surgery, your body isn't operating normally. Machines are helping keep you alive. Your heart may not even be beating on its own. So the warning signs surgeons expect might never appear. You are trapped inside the worst possible situation. Fully aware. Unable to move. Unable to speak. Unable to escape. As the procedure continues, surgeons divide the breastbone and open the chest cavity. Every second feels endless. Then something unexpected happens. Your mind starts fighting back. Some patients report drifting away from reality. Others describe floating above their bodies. A few claim the operating room fades completely. And this is where it gets weird. A woman who experienced anesthesia awareness during surgery later described an out-of-body experience while still partially paralyzed. For a brief moment, terror was replaced by calm, warmth, peace, even a feeling that something unseen was nearby. But was it the brain protecting itself? Or something else entirely? Nobody knows. And that's when the story takes an even darker turn. You might assume surviving the surgery ends the nightmare. It doesn't. Because the real damage may begin afterward. The moment doctors finish repairing the blocked artery, your body is finally stable. The operation is a success. But your mind remembers everything. Every sound. Every sensation. Every second of helplessness. What happens next changes everything. Many survivors of traumatic anesthesia awareness report anxiety, recurring nightmares, panic attacks, and symptoms similar to post-traumatic stress disorder. Some become terrified of hospitals. Others can't lie flat in bed without reliving the experience. A single operation can haunt someone for years. But here's the twist nobody expects. This nightmare is incredibly rare. Anesthesia awareness affects roughly 1 out of every 19,000 patients. For most people who experience it, the event is brief and causes little or no pain. The horrifying scenario you've just imagined represents an extreme worst-case outcome. Yet the possibility exists. And that's what makes it so unsettling. Because every time someone is placed under anesthesia, they trust that consciousness will disappear completely. Almost always, it does. But on extraordinarily rare occasions, a person may find themselves awake between 2 worlds. Unable to move. Unable to speak. Aware of everything. And when they finally open their eyes after surgery, one question remains. If your mind can wake up when it's not supposed to, how do you ever know it was truly asleep in the first place?